Okay, so as I said, I would just like to take an opportunity to introduce IFCO and to give us some context for the reason for today's webinar. So if we could move to the next slide, please. What you can see here is, and for those of you, as I say, who've already been involved with IFCO, will know, is a global not-for-profit networking organisation. It serves to promote family-based foster care around the world, but it has a 40-year legacy of making a difference in civil society. And as I say, although I'm newer to the organisation, that's something that I'm very proud to be a part of that heritage and the difference that IFCO has made in a global environment. Our organisation comprises a multicultural collaboration, and those that you can see the screen, that we have a collaboration of foster carers, former carers, social workers, children, families, academics, professionals, care leavers, researchers, media and policy makers. And that is one of the things that I think continues to be a unique strength of IFCO, is the ability to bring together multicultural collaboration on an international platform. Thank you, Jean. Then next slide. But it's primarily because this vision is driven by the belief that if they so wish, that all children in alternative care should live in a family-based care, because this form of care offers children the best opportunity to grow and prosper. And I think as we come through today's webinar, for me it's really important that we're holding on to that vision and absolutely about where alternative care and the structures and systems around that should be about being child-centred, family-focused, and about the needs and the rights of the child. Thank you, Jean-Anne. Next slide. So for the format for the webinar today, we are going to have an introduction and our welcome. We have some questions that have been submitted by yourselves for the panel. So we will start off we will start off by asking the panel to talk a bit more about their roles in out of care standards and review of care. We will raise some of the questions that you have as an audience, and then we will also try and filter through any questions that you might come up for you throughout the webinar. If you're able to put them into the chat function, then Jean-Anne will also support us by ensuring that we try and make sure that we answer any questions that come through the chat. Please don't wait until towards the end of the webinar, because it helps us if there are questions that come up to be able to try and weave them in throughout, because we do want to make sure we've got time to be able to answer as many as we can. We'll have just a quick bit around asking you to do some feedback on the webinar, and then we will close this session. I would just ask again, just to remind you, if you could mute throughout the webinar, please, and not to take photographs, because prior consent would be required from all participants in order to be able to do so. But we will be recording this session and it will be available on our website, and we will invite you to share resource links both in the chat function, and also we will pick those up and circulate those. And when I say we, that's a royal we, I really mean Jean-Anne. Okay, so if we could just move on to the next step then. As I say, I'm going to ask John first of all to introduce the Quality for Children project that IFCO is involved in. I'll then turn to Matthew around the developments in Malta, and then bring in Beth's experience of an independent review of care in a country where standards are well established. So John, over to you. Please start off by telling us a bit more about the purpose of the Quality for Children project, what it was needed, and why we were involved. Thank you.
Okay. Thanks everyone for making contact with us. My personal experience in developing these Quality for standards was very enriching. I've been a FIFCO member for a number of years, and the Quality for standards started in 2003 and ended up in 2008. And over these past years, I participate in a number of IFCO conferences, as you can see, and I always, with the help of other people, organized 2 IFCO conferences here in Malta in 2007 and 2017. Next slide. The idea of why these standards, all right, it was because in a way, Europe was getting as bigger and bigger, and there were, if nothing would have been done, every country would have had his or her own standards. And it was the idea that if we can have one unified document, it will help each country to develop their own standards, but based on these standards. And you'll see why later on this is important. The next time. Mela, all the standards have been ever seen in our life. Usually the standards, they are written by experts. So this was important because it was different from what happens usually. This was a process of bottom up, where you had all the people who were directly involved, such as children, carers, foster carers, social workers. They said they were involved so that these standards will become they are written because what they felt it was important. So the vision was children out of home, children without parental care have to be given the chance to shape their future in order to become self-reliant, self-sufficient, and participating members of society through living in a supportive, protective, and care environment which promotes their full potential. So that was the vision of Quality for Children standards. 3 organizations came together: SOS Villages, IFCO, and FICE. More than 500 people, all right, participated, and we collected 332 stories with the experience of out-of-home child contributed to the development of these standards. And nearly half of them were children, young people, and adults with care experiences. So it was important that these standards are developed from these stories. Next slide. As I said, there were 32 countries that participated. These are the countries that participated. And I think the most important thing is the method that was used in developing these standards, which is the storytelling method. So the idea was to let young people or social workers or foster carers or care leavers say their own story, what was their experience in getting into care, during the care process, and even after care. So that through these stories, the standards were developed. In summer 2004, national coordinators met in Innsbruck in Austria for the first time. And between 2004 and 2005, a number of stories were collected and sent to Innsbruck, where they started the evaluation of these stories. These are some of the quotes. For example, I contacted Children's Services and they took charge of the situation. They responded right away. That day I realized that Children's Services really did have my best interests at heart. I was even involved in the decision about where I would move to. This was a girl from Norway. For example, another quote, the future of foster care started meeting with children, but the transition process was not rushed. They would meet for 1 or 2 hours, then increase their contact. So through these quotations, through these stories, standards were developed. For example, the first one was that it is important for children to have their say where they are going to be placed. The second one was the standard where it was important that the transition from residential care to foster care, it was done to a planned process. It wasn't just they was grabbed from one place and dumped to another place. So that was another standard. So when these standards were collected, finally 18 standards were established. Standard 1 was the area of decision making and admission process. The second standard area was during the care, what happens, what's supposed to happen. And then the third area was the leaving care process. So even including aftercare. So the area of decision making was, the first standard was to give support to the birth family of the children to avoid, in a way, coming into care. The second one was to empower the participants if they had to give up their child. It was a decision taken between everyone. Professionals taking the decision had to make sure that the best possible care was given to the child. The other standard 4, was keeping siblings together as much as possible. The transition, as I said, from the new home to the foster home, it has to be very sensitively implemented. All right, and the 6th standard was out of home care process is guided by individual care plan. So this was very important, that any decision taken to remove a child, there was a care plan. So when the child comes into care, the standard that needs to be reached, that the match is done well for that particular child, that the child maintains contact with his or her family, that caregivers, foster carers, whoever, are qualified to do, all right, to give the care needed. The relationship between the child and the caregiver, all right, is based on understanding and respect. And nowadays, even the understanding of the traumatic experiences that these children pass through prior to coming into care. Children are empowered during, for instance, case reviews and sort of thing, to be given a voice, which is very important, so that when a decision is being taken during a case review, the child has the power to participate. Another standard was important, that where the child is living, there's appropriate living conditions. Children with special needs need to receive appropriate care, and the child or young person has continuously being prepared for independent living once he comes to leave from care. The third area was when the child or young person is going to leave care. And this was very important, because a number of young people used to say that once they leave care, they did not have any support. So this was very important, because for them, leaving care, it was something big. So they needed to feel that there is support after they leave care. They just don't be left alone. So that these standards, especially following up and being given continuous support, and having possibilities to ensure that was a very important process. Next slide. So it's the structure of the standards were that a quote was given, as I read in the previous slides, who have the responsibilities to meet these standards, the guidelines showing the requirements related to the implementation. Then there's part of it were warning signs. Warning signs, it meant that to achieve certain standards, certain difficulties that might hinder the implementation must be identified. And the last is that each standard is related to the Convention on the Rights of the Child. So the implementation, there was a presentation of these standards in June 2007 at the European Parliament in Brussels. Several countries implemented these standards. In my country, we implemented these standards, and Matthew will continue saying how these developed later on. In South America, certain countries, they even use the same process that Quality for Children used. There were even the introduction of these standards in South Africa, and these standards were even taken into consideration during the process of developing UN guidelines for children out of home care, and Quality for Children took part in these developments. But now these standards, there's more to be done in other countries.
Thank you, John. Really helpful context. And I think it's, for me, it's really interesting about how early on these standards have been and this project's been developed, and yet where we are internationally around standards of care as well. So thank you very much for that context.
Thank you.
And as you've already indicated, I'm going to hand over now to Matthew. Matthew, could you just pick up the mantle now and tell us a little bit more about how Malta has developed and implemented standards, please? Thank you.
Thanks a lot. In 2018, the Social Care Standards Authority was established by an act of Parliament, and such authority became responsible to regulate all social welfare services in Malta, which are circa around 350 services. The core values of this authority is to improve quality and standards in social welfare by dialogue and collaboration. And I will mention a lot these two terminology because we believe that when you are in a process to establish, to regulate, dialogue and collaboration are two main pillars vital in order to enhance social welfare services that will lead to promote the aspect of dignity, safety, and even a person-centered approach. When we are discussing about the aspect of alternative care, and in Malta in 2009, we had the first document of a national minimum standards that were developed only as a policy document, not backed up by any form of legislation or legal notice. And very recently, actually now last year, we started to develop something new. We wanted to evolve, we wanted to have standards that do not increase bureaucracy, but rather will have a person-centered approach and actually provide the opportunity to have the best interest of the child. And when we are saying the best interest of the child, we are all are aware that we have different conventions, we have different policy documents that made clear reference to the best interest of the child, but actually we wanted to have standards that actually provide the best interest of the child by having a direct, active participation even in the establishing and developing of such standards. Indeed, this model provides to be more in a position to be enforceable because it is developed by a legal notice. We developed guidelines for professionals that are social workers, care workers, in order to provide them with tangible elements how to attain quality of service. And the third document that we establish as part of these standards were the easy read version. And I'm very happy of this document and I'm very proud of this document because this document provides a clear vision, provides a clear direction what children should expect from these services in a very simple terminology with a lot of pictures. Indeed, even when we develop the actual physical document, different children coming from foster care, coming from living in alternative care, were actually involved in different focus groups because we want to adopt a bottom-up approach. These standards are developed and are utilizing even the definition of the child from the United Nations Convention on the Rights of the Child. We are emphasizing a lot about the rights of the children, the rights of the child to participate and to have active participation. We had a very large consultation process because we wanted not to have a document that makes a big hit when it is launched and then someone just throw it in a drawer and forgets about it. But we wanted to have a document that actually have a clear impact on the life of children and assist and guide different professionals that are working in this sector. Indeed, we wanted to move away from standard documents that provides a lot of standards, but we wanted to emphasize on a number of standards. Actually, we developed two sets of standards made up of eight statements. Why two sets of standards? Because we made clear distinction between the services that are offered at an office-based and those that are offered at a residential perspective, and even the office-based provide a clear assistance even for foster care. Our aim was to help professionals to feel that this document is not something that is creating procedures that are bureaucratic, but otherwise these standards are there in order to assist in the actual implementation of their work. The first statement, and we started with a strong statement about the rights to participate in decisions. And here we are promoting a lot, and now all service providers have to adhere with these standards in order to have the children that are active participants in all forms of decisions. We even worked about the quality of care, and about the quality of care, we went into details about the caring and protective environment, what type of environment, about the aspect of siblings, the importance of having siblings meeting. But the third standard statement moved about the care planning. So basically, everything should be done with a particular plan, a plan that should be reviewed every 6 months, a plan that should involve all main stakeholders, that should encourage dialogue, encourage discussion, with the purpose to have a child-centered approach. For the first time, we introduced a standard that deals directly with the aspect of the healthcare needs. Basically, we looped in our health authorities, and they were direct partners, in order to develop a standards that ensure that healthcare needs of the children are addressed by an appropriate medical team beyond the universal services. So here we are providing additional, and we are encouraging that even foster carers will have the required and additional support in terms of the area of healthcare. The fifth standard is a standard that when we had the focus groups with children mentioned a lot the aspect of education, the aspect of enjoyment and achievement. And here the standards provide importance of the aspect of the social, the aspect of the extracurriculum activities, and the aspect of having children reassured that they are in the driving seat. Yes, we want to have our children in the driving seat when it comes to their life. We'll have adults, we have foster carers, we have professionals that are there to support them, but we require to send a message that you are in your driving seat according to your appropriate age here, but we should start sending. About this point, even when I was active in different NGOs, I didn't like the fact that you are invited for a consultation or for a policy document, but you realize that once you are for a meeting, the document is already set up. The document is already finalized, and you have been invited only as a formality. And indeed, from the document that we've published in the pre-consultation and then in the consultation until the last document, I am proud to say that my research team changed a lot based on feedback that received from foster carers and from professionals, but mainly from feedback that we received from children. And in certain times, different people coming from different areas like to utilize a lot the terminology, the best interest of the child. We involve children, we involve service users, but saying this statement is not enough. We should empower more, and indeed as an authority, even it is part of our vision that we empower our service users. And this document provides a clear vision that in Malta and our service providers, from this year and in the coming future, we will be working more together. And I'm very proud because we have service users coming from, service providers, sorry, coming from the government, the church, NGOs, we have the National Fostering Association, and we have a massive potential. When we work together and actually our common ground is the best interest of the child, it's amazing what you can achieve. And when I go through this experience and when I see what we achieved, even when it came to the standards about positive relationship, the siblings, even the aspect of including the term service quality management. So basically we are introducing more the concept of accountability in social welfare services. Yes, accountability, the type of policy documents that one requires to find in service providers, what type of training. And indeed, I enjoyed a lot John when he mentioned about the aspect of having carers that are well trained, and we are going to emphasize a lot about this aspect of continuous professional development. And when I review this exercise, having standards is something amazing, it's something very important. Having standards backed up by law, it is important. However, the actual implementation, when I'm attending College of Regulators in the social welfare, we discuss a lot about standards. I like always to mention the aspect of the enforcement, the aspect of inspections. Indeed, in the last months, even having the COVID situation as an authority, we kept working on the aspect of inspections. Indeed, we did a lot of inspections and a lot of virtual meetings involving children and professionals. The aim is that we keep providing feedback. As an authority, we're not here to issue administrative fines. We are here to ensure that services are provided according to standards, but actually we are here to provide feedback in order to increase the level of quality. And during the last months, we also developed a platform, a collaborative platform, where all service providers are involved in order to encourage more about sharing, because it is important that we share between us best practices and even lessons learned from each other. And when I review this exercise, I strongly believe that as a regulator, regulators should not be there and start developing standards. They should be there in order to establish standards, because when you are establishing something, in that process, you are including dialogue, you're including collaboration, but at the end of the day, you are realizing what the vulnerable people, in this case, children, would like to see. Indeed, something that was amazing. Our Maltese children, they told us we would like more to have meetings with our siblings. For example, you have siblings that are living in foster care and someone living in residential facilities. They would like more to meet with them. And we made sure that this recommendation is written very clear for the respective service providers and other authorities in order to ensure such will. Thanks a lot.
Matthew, thank you so much for taking us on that part of your journey, both in your organisation and as a chief executive, as well as your country. So that has been really helpful. I just want to acknowledge that some of the questions that we've received from registrants will start to be touched upon as we have speakers sharing their experience. And we will also take an opportunity after I ask Beth to share her experience with us to be able to explore those questions a bit further. So before we do that, again, thank you very much, Matthew. Beth, could you tell us a little bit about your experience in being involved in the Independent Review of Care in Scotland, please? I'll hand to you now. Thank you.
Thank you, Jo. In 2016, the First Minister of Scotland, Nicola Sturgeon, met with a group of care experience people, so people who have experience of out-of-home care, and they lobbied her for a review of the whole care system because it wasn't meeting the needs of the people it was seeking to serve, i.e. the children and young people and their families. And so she announced at her party conference that she would be proposing an independent root and branch review of care, and what that entailed was 4 stages. So she was determined that the person that would drive the care review and the chair of the review would be care experience themselves. So she appointed Fiona Duncan, who has care experience. She also, right from the start, Fiona was committed to making sure that the review would be a review like no other, and it wouldn't be held within the custodians of the system or the professionals that are working within the system, that this review would be driven by care experience voice, and she made sure that voice was at the centre of that process for the whole process. So the 4 stages of the review were orientation, discovery, journey and destination. So in orientation, that was about the chair and her team of secretariats figuring out how best to run the review. And Fiona would often say it was about her talking to other people and finding out what the chair of a review does, and maybe what people found, what people regretted when they previous chairs, what they regretted about the way that they had conducted the review. And oftentimes it would be that their recommendations weren't implemented, which left an ingenuity gap, which is the gap between policy and practice. So in Scotland we have really strict and robust and really good standards for care, but how those are enacted in practice sometimes is completely different and isn't the way that we would wish it to be. So that part of it, that section of the review lasted for a few months. The next section of the review was called the discovery phase, and that is where the discovery group was made up of 50% of people with lived experience and 50% professionals, but some people straddled both, so some people were care experienced and a professional in their own right. And what that group was there for was to steer the review, to ask 2 main questions: what would the best care system in the world look like, and what does root and branch review mean to you? So that part of the review went wide, not deep, and and gathered information from hundreds and hundreds of people with lived experience and people who are in and around the care sector. The next stage was the stage that I was involved in, was called the journey phase, and that was the time now for us to dive deeper into those gnarly issues, and figure out what bits of the system, like how we can improve the whole system, ensuring that we weren't just looking at one component of the system, polishing it and putting it back into the system, because previous reviews have told us that that doesn't work because the system would swallow it up. So the journey phase was made up of 10 working groups that looked at every single aspect of the care system. Those included work groups such as health and wellbeing, components of care, care and justice, and one of the groups that I was on myself was the best place in the world. So we were tasked, our working group was comprised of 50% with lived experience as well, and we were comprised the task of scoping out what would make Scotland the best place in the world to grow up, what that would look like and how that would feel. And myself and my co-chair John Carnigan were pretty clear from the start that if we were making Scotland the best place to grow up for children, we were making it the best place to grow up for all of our children, as well as those with lived experience having kind of extra protective measures in place for them. So we had worked for 18 months on the journey phase, and when that concluded, it ended up we entered then into the destination phase. So 7 reports were produced from this. It was called, the first main body of the report was called The Promise, and that set out 84, I think, asks of government, rather than recommendations, because we were pretty clear that we weren't recommending it. This had to happen. This has to happen in order to evoke positive change within the care system. So that was one of the reports. There was a pinky promise for younger readers. There was the plan, which sets out a 10-year overarching plan, about a blueprint basically for how we can do things. There was the rules, which looked at the legislative framework and what works and what doesn't work currently, because there are 32 pieces of legislation that touch people with care experience lives in Scotland currently. Also, the follow the money, and the money looked at the economic and the human cost of care. So it was very much focused on how we can save money for if we invest further upstream, and it calculated the total cost of care in a year and how much we're ploughing into the care system, and that figure in Scotland was £1.2 billion, was how much we're putting into the care system, but also other services upstream that people are having to use due to their care experience and experience that they had whilst they were in care. And the last one was a thank you, and it was a thank you for speaking to for all the 5,500 voices that were heard throughout the care review. There was over 5,500 people spoken to within that 3-year period, and that was really just a thank you about for the people that had contributed to the review. And personally, and personal reflections on it for myself, I found it to be a really refreshing experience, because this was a review like no other. Fiona was determined from the start that this would be driven by care experience, and it absolutely was. We gained cross-party support from it the day that it was launched on the 5th of February in Parliament, which means that politicians have now committed to keeping the promise and making sure that the promise is achieved. And I guess for me that was just such an overwhelming day, because I was so proud of how far we had come, and I was so proud of Scotland and how it's chosen to respond and treat and care for our children who need cared for out of home or looked after at home as well, the full care experience community. And I think that I was determined right from the start that my experience is what drove me to the table, but it wasn't all that I brought. I brought professional experience as well, and I had something to say on the matters, and I felt confident in my ability to put that across. So on the 5th of February, when it was announced and all the hard work had been revealed, I think I was completely overwhelmed, because I knew that never again should a young person have to experience the things that I had experienced growing up in care. And that's something that I'm continuing to work hard on and lobby for, that no child has to have an experience like the one that I've had. But equally, that doesn't mean that they're not going to go on and achieve great things, that they can function as members of society. So that was the independent care review in a very brief whistle-stop tour nutshell.
Thank you, Beth. And again, thank you very much for sharing your experience. I wanted to just know that Jeananne has been putting some links and signposting things in the chat, so please feel free, people, to have a look at those and see if that brings any questions for you. And as we're doing that, I suppose there's some of the questions that came through I would like to be able to just bring back about just now. And there was a couple of them that are themed around COVID-19 and how responses have been around that. Beth, I'm actually just going to come back to yourself first of all, and that's just because being in Scotland, I'm aware that COVID had an impact on implementation. Do you want to say anything just about the impact that COVID had, anything that you experienced differently during COVID that you would want to reflect on?
Yeah, no problem. So the impact that COVID-19 stalled a bit for the review transitioning into what's now called the Promise. The Promise team are a very small team just now. They're currently recruiting for more people to be able to help deliver the Promise that Scotland set out. But I think COVID had an unexpected view on an unexpected experience for people. It was an experience that people hadn't felt or experienced before, so that meant that Scotland had to change and the whole world indeed had to change the way that it was working, and it had to be radically different, and it had to be very quickly achieved. So that includes a lot more virtual contact, such as webinars like this, and I think that the cross-party support is something to be kind of held on to, because they agreed from the outset that they were going to fulfil their duties as corporate parents and keep the promise. So I think that although COVID-19 has stalled some of that work, we found out a new way of working and a new way of normal, and our new normal is kind of virtual working from home, and the Promise is still more determined than ever to achieve the change that is so desperately needed for children and young people in Scotland. So I think that as much as it had an impact at the start, we're beginning to work in what our new normal is, and we know that things still need to change. Also appreciating the fact that it could have placed more children at risk during the pandemic, which I think added fuel to the fire for Scotland to begin to understand what it needs to do differently.
Thank you, Beth. Really helpful, and I'm sure there are people around this virtual table who will be able to give examples of where there have been positive changes that have happened in terms of practice that have been potentially arguably more child focused, because there have been many structures and many aspects of bureaucracy that have been able to be mitigated against. And I'm also interested always in the balance that is meant to put in place to be able to supporting, as well as the enabling factor of any type of system that we are operating in and within for children and young people. Matthew, you had touched a bit around how, one of the other questions around this, about how you ensure that standards are maintained and how they are adhered to. And you had touched on this when you were talking about still undertaking inspections during COVID. So could you give us, one of the questions that was around that was, are children still being placed in foster care during the pandemic, and if so, in what way? And sort of reaching on from that is therefore, so how do you ensure that standards have been maintained during that period and beyond? Because obviously it's not just one period in time. Matthew, any reflections on that?
Thank you. With regards to the implementation and monitoring of standards, basically in Malta, through the Social Care Authority, we implement three types of different inspections. The first type is the licensing process. So basically, our assessors and inspectors will carry out a number of visits utilizing a quality tool that is based on the performance indicators that are written down in the standard. So basically, these are tangible measures that different professionals require to carry out every single day. So in this way, we are able to measure the level of quality from an objective perspective. The second type of inspection is the inspection that we carried out on a regular basis. Each visit will have a particular purpose, for example, facilities, care plans, what type of activities they are carried out in a particular home. During such visits and even in the licensing process, we have time and even to discuss with children in order to attain feedback and to provide them with the necessary voice. And the third type of visit that we carry out, it is entitled feedback, because we receive, for example, a complaint. In Malta, we are trying to change that terminology from complaint to feedback, and as an authority, we'll carry out a full investigation according to Chapter 582 of the laws of Malta. And such investigation will not only be carried out by our staff, but if we deemed necessary, we'll open different independent professionals according to the area and according to the sector. With these three types of inspections, we are making assurance about the implementation. However, the next stage is that we develop what we are calling a service users advisory group. A service users advisory group is to have a panel made up of different different service users, children, according to the sector, and we will be meeting regularly in order to receive feedback directly and in a structured manner. And in the coming years, we are envisaging that jointly with our assessors, service users will be attending for inspections and will provide necessary feedback, so that our licensing process will not be only done by our professionals, but even we will be involving directly service users.
Thank you, Matthew. John, I just wanted to give you an opportunity to come in here at all, if you wanted to, in terms of experience of placing children or young people in foster care.
I think at the moment in Malta there are some placements being done. In fact, from information I have from the National Foster Care Association in Malta, the agency that provides foster care service, they are even giving online training to prospective foster carers. So in a sense, COVID has made a little bit life difficult, because when you come to give online training and even assessing, it's not that easy to do. But I've known that children have been still placed with already approved foster carers. So that's one type of placement that's being provided here in Malta. And I think social workers from the local agency, they're trying their best to meet even certain standards that foster care should be provided. I think COVID has created a little bit of difficulty. It's a reality that unfortunately no one can escape. But I think the fact that they are still providing online training, it shows that there is a big need to find new foster placements, so that, because the demand, I think what COVID has done as well, it created a lot of need to find more placements, because the number of children needing a placement has increased since COVID. So I think that is a big challenge that the local agency has in its hand at the moment.
Thank you, John. And also just linking to the thematic here around COVID-19, question I'm going to put to you all is, and this is really about opinion, do you think that NGOs working in alternative care should have an alternative vision and mission during COVID-19? Let me see. Matthew, can I start with yourself on that one, please?
In Malta, NGOs working in the sector of alternative care, they provided a very important contribution indeed. We have an NGO that is an NGO related to church that kept going the services in certain times. They even volunteered in order to have the services and the professionals living in. And they did a huge sacrifice, and I would like to recognize the efforts and the huge sacrifice that these professionals did. And when I see these attitudes, I encourage even my staff, because that is the dedication, that is the difference between having a professional working in the financial sector and having professionals working in our sector. The dedication that we do, that extra mile for the children, because you invest so much time, you invest so much dedication, that you don't want, because of the COVID, to lose everything. And not to lose everything, not in terms of a KPI, but in terms of the best interest of the child. And when seeing these type of sacrifice that we're seeing, and even the aspect of having different entities collaborating, having different changes even about the type of visits, rather than having the actual physical visits, we're having visits on different online system, the visual visits. So basically, I like to say that NGOs in Malta in this sector did a great job, and even our national entity and even the Fostering Association. What I've noticed also, the level of collaboration, that in these difficult moments, rather than everyone trying to keep their own territory, I've noticed the level of support and type of dialogue. And I like to say that what we've invested in the last months during the difficult times of the COVID, and we shall admit, we are not speaking about an exit strategy in the COVID, but we are speaking about a transition. We need to adapt ourselves to this new reality. We need to have and to train ourselves for a long-term marathon, not for a 100-meter sprint. And we need even to envisage how our services, even in the area of alternative care, need to develop to such new reality without having any form of impact on our children.
Thank you, Matthew. Beth, I'm going to ask you the same question, but possibly in a slightly different way, because the group that you were involved in was about reviewing different practice in the world. And so there's something in here about how important values are, as well as when it comes to a vision and mission. Did you, and when it comes to alternative care, when you were involved in that group and all the work and the research that you were doing, was there any examples or sort of vision or mission that you thought, yep, that's something that actually is really important, we should be doing, that you didn't necessarily see happening in Scotland or anywhere else?
Yes, we looked at several different models of care and out of home care. We looked at some of the Scandinavian countries, and we looked at places like Sweden. And what we discovered was they love their children, but as their children grow up to teenagers and begin to engage in that bit of rebellious behaviour, they only tolerate their teenagers. We talk about in Scotland how we tolerate our children. We're not at a stage of loving them yet. We're not there. We also looked at a Danish model, which was a homemaker model, where as soon as a mum becomes pregnant, they're assigned this peer support kind of worker, a mum themselves, who has been through childbirth and raising children, and what they do is they're there for that support right from the very beginning, from the pregnancy right up until the child's 5 years of age. And what they do is when the child's born, for the first kind of 2 weeks, they move in with the parents to give them a hand, helping with the baby. And then after that, they begin to tailor back their support, but they're always there for a natter on the phone, or they go and visit the family and stuff like that. So we looked at models like that could help us start to truly value our parents, and how what we focused on most in Best Place was how do we get it right for our parents, because if we get it right for our parents, we're going to get it right for the children. So we spent quite a bit of time looking at that. Our values right from the start were compassion and not being afraid to dream the dream. We were given an ambitious task, and we weren't afraid to look at things slightly differently. We also looked at models of like a universal basic income. We looked at places like Finland, and what they do, and Scotland's already adopted some of that practice, such as the baby box. But what we quickly realised when we were looking at that is that was one component of a long line of support, and a massive length and breadth of support for Finnish citizens. So we were looking at how can we stop kind of picking up the shiny bits that we like and trying to transfer it over into Scottish civic society, because we're acutely aware that what works in one place might not work in another place for a very specific reason, especially across the length and breadth of Scotland. What works in one local authority might not work in another, and it's about channeling that and looking at taking that apart and picking it apart and finding out why, and then more of that how can we go about creating this. So I think the values and the attitudes that we had were prevalent from the start right through to the very end of the process. And I think if we didn't have the values and attitudes that we did, and we didn't have the people around the table that we did, we would be looking at a completely different outcome. So yeah, like, I hope that answers some of your question.
Yeah, lovely, Beth, thank you very much. And I think even just when we're talking about, I hope people will be able to look some of these things up as well, because I also know, having been involved with IFCO, that things that we refer to will be different in some countries compared to others, and can have quite different meanings. So I also want to come back to yourself, John, in terms of values. And then from your perspective, values, but values that you feel are important, that were important pre-COVID, that have continued through COVID and into this next phase. Any values that you would like to pick out that you think you were talking about when the standards were being developed, about who was involved? Do you want to expand a little bit about the values that are important to sustain us in alternative care?
I think as regards, as Matthew was saying, COVID has brought out the best of, for example, in my case, through the association contact with the foster carers, the fact that they spend a lot of time with the children at home, staying there with them 24/7, because for some of the foster carers, this experience was completely new. So in a sense, not having children going to school, having online classes, this brought a lot of pressure to a number of foster carers, which in a sense, when you think about it, that most of these children, unfortunately, since they pass through a lot of traumatic experiences, and they need to move out and have a lot of experiences outside the home. Unfortunately, through this experience of COVID, they had to stay indoors most of the time. So even having online schooling at home was completely different. So in a sense, when you think about it, the value of really being dedicated towards these children, the value of really helping to understand these children's behavior, helping to sort of, even when they have contact with the birth family, for example, through online contact. This was completely new, and certain experiences were so new that really foster carers needed a lot of support. And I think through both the association and the local agency, they were given support online and even through phone calls. You know, I think having that togetherness, working together, it helped a lot to a lot of people. And I think, as Matthew was saying, I think one of the things that this COVID brought together, the understanding of working together and giving support to people who really dedicated their lives for these children. And I think when you think about this new experience of staying at home, doing things creatively at home, because when I look back at foster cares, the amount of initiative they took in creating activities at home to create a better relationship with the child they are fostering, it was immense to see. Because for me, it was something which you admire in people, that although all these difficulties that they are passing through, still they still managed to keep these children and not have any breakdowns, because that's another issue that could end up in having breakdowns of foster placement. So the idea that you still have people, by giving them support and being creative and understanding the needs of their children, in a way, it is a successful story and appreciation of the values that these people have.
Thank you, John. So just a couple of questions that are around back to standards in general. So one of the questions was around, should standards be established before setting up a service? And I'm interested to hear your opinion on that, Matthew, as a regulator. So what would your response be about standards being established before setting up a service, please?
The preferred idea is to have actually certain standards and criteria exist prior having or establish new services. And I'm saying this from our own experience, because our services have developed during the last years, and when the authority was established, we had a very difficult task to develop standards then and try to develop new bars, new quality, having to set long-term planning. However, if we would be in the ideal scenario, it is better to have certain standards, and even we discussed this theme a lot amongst us as regulators. We need to set certain standards in a way that they are future-oriented. Also, I like to say that standards are not cast in stone. Actually, until the end of this year, we'll be having all sector regulated in Malta. And from 1st January of next year, we will start reviewing the first standards that we actually developed. It was standards in the area of adoption. So basically we'll start reviewing, because the establishing standards is not a process, just you establish a standards and that's all. It's a continuous process where updates are required, feedback is attained, actually you start monitoring what is actually being implemented and how, where you require to enforce more. You learn, actually, even from our first set of standards until today, we've learned a lot, because you may be very future oriented. However, in certain times, you require to develop a more structured plan. So you will have the longer term perspective, the medium actions, and the immediate actions. And even in standards, we need to be working on this. Moreover, we need to see a lot and more standards that are more tangible. In most of the times, we had the opportunity to review standards in different sectors, and you will find different elements that are very, very subjective. We need to have elements that may be measured, because what you can measure, you can control. What you cannot control, it's impossible. It's subjective, and subjectivity will totally not leave a positive impact in terms of quality, and quality that actually will leave impact on our service users.
Thank you very much, Matthew. And the other aspect that we've been asked about for these questions is about the roles of different people in the standards, how they influence them, how they might be rolled out to them. So one of them was around the role of the supervising social worker, and another question was also around when you are introducing standards, how do you introduce them to foster carers? Beth, do you have any experience you'd like to reflect on from the care review?
I think the one thing that I would highlight would be it's important to bring people with you on a journey, and not be seen to have created standards, and or like the professionals have created standards and this is what the professionals think. It's important that we gather their views, their opinions right from the start, so that they feel part of that process, rather than feeling as if something's been imposed on them. And I think we took a lot of learning from the care review with that, where people were more open and willing to speak because they felt part of a community of voices that were seeking to seek change, and for one main reason. So yeah, just take people with you right from the start, and you can't go far wrong. And even though having those difficult conversations sometimes can be quite challenging, it's about holding that complex space and ensuring that everybody feels that they've been heard. And that was one of the biggest values of the review, that everybody has a right to be heard. So that's all I would add.
Thank you, Beth. That's helpful. And John, would you like to comment on that at all?
I think the idea of explaining standards to foster carers, prior or not, in a way, I think once a child is placed, you as an agency, you have to make sure that there are these standards, that they're being provided. So in a sense, having standards is important, so that you make sure that the quality being provided by the foster carers is there.
Thank you, John. Matthew, I could see you nodding. Is there anything you'd like to add to that, please?
When we're developing standards, I think, even from a regulatory perspective, the aspect of having people involved in this process, rather than having standards developed from an office based, I think having people involved, and John mentioned it when their team were developing the actual standards, having people involved, it is something very important in order to create ownership, rather than you will perceive standards as something being imposed on you. you will perceive standards as something that you developed, you contributed, and you believe in them. And I think that unfortunately, even when developing certain legal notices in different areas, even from my experience working in different sector within the government, I've realized that by creating ownership, you will facilitate the aspect of implementation more than by 60–70%. And ownership is quite vital, I think, even in the area of standards.
Maybe something I could add to what Matthew's saying is that by having this ownership, you are building trust. And I think this is the most important thing, that foster carers, they know that they are being trusted. And once there is that trust between the agency, the association, the authority, you know, I think the issue of trust, which really reflects even at the placements of children, I think the most difficult part that they have in trusting adults. So in a sense, this issue, when you have people involved in the decision making, what you are giving across is that your voice is being heard, and with trust you, and the relationship it builds on and it grows. And I think this is one of the most important messages that the issue of collaboration brings across.
Thank you, John. And you have brought that nicely to really what is going to be one of my last questions to you as panel, is if there was one thing that you wanted to be able to get as a message across to everybody that is here today, whether that be something that's been very successful or a barrier that needed to be overcome or a value that you think is important. I'm going to ask each of you if you could share your final message to everybody around this virtual table. So can I start with Beth, please?
Yeah, no problem. My one takeaway would be to always value the lived experience and people with lived experience, because they can create some pretty amazing things. They can shape and help deliver and help create so many different but wonderful things. So that would be my biggest takeaway, is always ensure that lived experience is centred to any process, that we're no longer doing to people, we're now on that path of doing with people, and bringing people along with us, and that would be my biggest takeaway for today.
Beth, thank you. John, could I ask you for yours, please?
I think to what Beth is saying, that listening to everyone involved, all stakeholders, is important, so that once you listen, you know that you're giving a message that you are appreciating other people's opinion. And even, as I said, the issue of trust is very important, that everybody's working together in the best interest of the children.
Thank you, John. And Matthew?
Having quality of life is something that we need to keep working for and to keep striving for. However, as both Beth and John mentioned, dialogue, trust, these are very important, and even as an authority, we believe a lot. However, I'm realizing that we need to be more inspired in our social field. We need to be more inspired. We need to believe more in social innovation. We need to look more about the potential that we have between us. And rather than work in territory, we need to work more as a team, be very innovative, use our creativity, and in certain times, empower more. And this is something that John was one of the first lecturers that inspired me in believing in empowerment in service users. And today as a regulator, I try to make sure that we are putting forward and putting this item first as an agenda, thus empowering our children.
Thank you, Matthew. Okay, so as we're going to bring this to a close, just got a couple of things we're just going to finish with, if Jean-Anne will bring those slides up. But could I invite those of you that are registered here today, if you would like to show your appreciation to our panel for Beth, John and Matthew, please feel free to do so in the chat function. Thank you. But just now, I would just like to say thank you very much to our panel for your involvement, for your contribution, and for a really interesting message, which can start off about standards, which feels as if it's something very logical, and actually concluding about something which is very much around empowerment and values and engagement and involving, collaborating, and the voice of experience, which is just fantastic. So thank you very much for bringing that message to us. Just before we close, we're just going to bring you on to a couple of last bits, please, around the webinar. So I would ask you to please complete this evaluation form that will be coming out to you. It really does help us to evolve and measure the impact of our work and about the areas that are of interest. If you're able to do so, we do appreciate any donations to support us in our mission. We've all been impacted by COVID, and for us, one of those was around not having our conference in 2020, but we are determined that we want to still be in and around very important messages that are happening globally. And as I say, any small donation would be much appreciated. This is all volunteer time that is ensuring that we have a programme of events just now. And you can do so through our website. Because of the interest that we've experienced around this webinar, we're also inviting anyone who might be interested in being involved in a short life working group, which would be more of a discussion group. And if you're interested in doing that, please become a member, because this will be a member working group. But also you can register your interest by emailing Jean-Anne at the email address that is on here, and obviously we will share that as well. And we will get some dates organised, which we will then be able to promote. And if you're not at the stage of being involved in a short life working group, but you are involved coming from a country that is interested in having a further conversation, we do offer training and consultancy services. And so again, we've got email addresses in there to be able to discuss care standards or other aspects of alternative-based family care. Could you do upcoming events? I just needed to promote for a second. We're obviously been doing a series of thematic webinars. Our next one we're hoping to have is going to be around education, and we'll look to do that, aiming to do that in September time. So again, I invite you to share with us any speakers you think would be interesting to have, not just in that one, but in future ones, as well as having a date set up for people to be involved. We have roundtable discussion groups. These are dates are set for these on our website, and that's for professionals and for foster carers. So if you're involved in a foster care organisation in particular, this is a membership benefit that we've developed. And we're also further developing our youth participation. I don't know if anybody can hear that somebody's just started cutting grass at the side of my house, so excuse me if that's a bit noisy. If you have an interest in Dare to Lead, we have a 2-day training workshop based on the research of Dr. Brené Brown. So again, if you have an interest, please let us know, because we're looking at how we are developing the dates for those workshops. And then finally, I think this, Jean-Anne, just wanted to say that we're launching our IFCO 2020 learning programme, and this is in lieu of the conference that we were having in Montreal in June of this year. And the final thing that I wanted to just highlight from that is our first webinar that is based on that series of keynote speakers that we were having at our conference. And the first person that will be speaking is going to be Talga, thank you. And really interesting keynote speech, imparting in-depth knowledge on Indigenous culture and history, and framing a new path forward based on inclusivity and equity. So that's the 16th of September, and we invite you to register to participate. I believe we've answered all the questions that came through. If there are any other, and we want to continue that conversation, maybe that's something that we'll be able to do either by email, or we could look at setting up that discussion group if people feel that's helpful. But other than that, I'm going to bring this to a close and just say once again, thank you very much to everybody, and please do complete the evaluation form. We do want to keep this level of engagement up, so we really appreciate your responses. Finally, once again to the panel, thank you very much indeed. Thank you everybody, take care. We'll stop recording.